Thank you very much, Sandra, and good morning to everyone. And welcome to today's webinar in celebration of World Cities Day. And to introduce the topic of discussion today, I'd just like to mention are now home to 55% of the global population, and this figure is expected to balloon to 68% by 2050. And therefore, the health of citizens in these urban areas is indeed an important asset which we need to protect. Yet, sadly, more than 80% of people living in urban areas are exposed to air pollution levels that exceed the World Health Organization air quality guidelines. And a larger percentage, 98% of large cities in low-income regions suffer from unhealthy air. Without the efforts of all the stakeholders, we will be seeing more air pollution in cities continue to worsen and that climate change will accelerate. The good news is, around the world, cities are inspiring us as they commit to achieve WHO air quality guidelines by 2030. And this is through the BreatheLife campaign. BreatheLife combines public health and climate change expertise with guidance on implementing solutions to air pollution in support of global development goals. Through this program, cities can play a key role in the fight against air pollution and climate change. They do this through many different ways, such as by putting in place policies and programs to reduce emissions and promote the use of clean energy, and driving national action to prevent air pollution from sources even outside the urban areas. Now, in Asia, my organization, Clean Air Asia, was able to bring to the fold close to 30 BreatheLife cities. So it is so inspiring to see that many Asian cities are interested and committed to reduce air pollution. Through the BreatheLife program, these Asian cities have received training on, for example, developing communication plans for clean air and on many different aspects of air quality management. I'm pleased to mention that clean air action plans for the cities of Manila, Santa Rosa, and La Trinidad are soon to be completed within a year and a half or so, as part of the science-based and stakeholder-driven approach to air quality management we promote in Asian cities. Now, today in this webinar, we will explore how cities are overcoming barriers to implementing air pollution solutions that provide multiple benefits, including for health and climate. Our eminent speakers are going to highlight solutions in the transportation, waste, and household energy sectors, and with a specific focus on the role of communities in driving change. Now, with this, I welcome you all to this webinar. Now, I would like to call on our first speaker to speak to us on how to tackle urban air quality, climate change, and health at the same time. Please help me welcome the head of the Climate and Clean Air Coalition Secretariat, Helena Molin Valdez. Helena?
Thank you, Glinda. So you already introduced the topic of having an integrated approach to climate, air quality, and health. We only have one atmosphere in the end, and we need to tackle the multiple crises or challenges through this more integrated approach. Can you go to next slide, please? So our Climate and Clean Air Coalition that is helping to host this webinar, we focus on reducing a series of specific pollutants that are harmful to people's health, but are also powerful greenhouse gases or climate forcers. So we are talking here about black carbon, which is part of the PM 2.5, the particulate matters, and the result of incomplete combustion. We talk about methane, and methane is also a precursor to tropospheric ozone and one of the main components of urban smog. And we also talk about cooling and other refrigeration chemicals used for that purpose, which are the HFC, the hydrofluorocarbons. So this set of climate forcers are really even more powerful than carbon dioxide, harmful to people's health and to ecosystems. And at the same time, the sources of these pollutants are often the same, that also creates carbon dioxide and other greenhouse gases. So the bottom line here is in the planning and execution of solutions, it's extremely positive and helpful to look into an assessment of both the air pollutants and impact on people's health from a certain policy measure, while at the same time working on the climate and greenhouse gas inventory. So next slide, please. We are on an unsustainable path when it comes to climate change. We, in the Paris Agreement, we commit to trying to not overshoot the 1.5 degree scenarios and to stay way below 2 degrees. There is no scenario or pathway whatsoever possible to achieve this goal of the Paris Agreement without having a very much integrated approach and reducing all climate forcers, and also to do other things like carbon sinks and forests, etc., to keep the temperature at that level. We are already now on 1.2 degrees as we stand from pre-industrial times, and it's impossible to reach the level we require without working immediately in early action of both long-lived and short-lived climate pollutants. And this is something that not every policymaker is aware of. And often in cities, and maybe we can hear from Accra, London, and Quito, if this is the case where you work, that often there is a complete division between the work on climate change in a city and the work on air quality and also on health. Often health and air quality goes together. So the call here is really to make a much more integrated approach, which also helps save a lot of resources in terms of planning and when it comes to investments. And as mentioned, many of these pollutants also have incredible health benefits, food security benefits because of the ozone impact on crop yields and other sustainable development goals like energy efficiency and access, etc. Next. So there are a lot of solutions, and depending on where in the world the city is located, for example, just on black carbon, it's possible to reduce those emissions to more than 80%, which countries and regions have done in some occasions. Like one example is California as a state, but also in cities where where there is regulations in transport industry and in the residential sector to reduce incomplete combustion, change of traditional stoves and fuels, and also to ban open field burning from agriculture. I'm just showing this slide to show that there are very concrete measures that could be incorporated into a city level policy to reduce the emissions. Next. We have in the Climate and Clean Air Coalition, which is a partnership of many, we have now 150 organizations, including 70 countries as part of this coalition. We have a wealth of very talented and capacitated organizations such as the Clean Air Asia, we just heard from Glinda, the World Health Organization, UNEP, of course, and many of the development banks and many of the city networks, ICLEI, C40 and others as partner in this coalition. All of them have different types of expertise, and we have a common solution center where you can help get access to both resource library, training materials on webinars, expert assistance, and other types of sources. Next, the final slide. And of course, we have a common campaign, which is what Glinda also already introduced, which is the BreatheLife campaign, which we hope can become much of a venue of collaboration and exchange among cities to achieve the WHO guidelines and reaching citizens of the world with the key messages and the information that can help drive policy changes towards a much more green development at city level that also help reduce air pollution. So over to you, WHO and Natalie. There is a lot to be said about this, and I hope we can continue the conversation. Thank you.
Thanks a lot, Helena, and good morning and good afternoon and good evening to everybody. It's a real pleasure to be here, and happy World Cities Day to everybody. And Sandra, can I maybe quickly ask to share the slides? Thanks a lot. So first of all, thanks for joining this important event, and thanks for the opportunity to share with you some of WHO's work and thoughts as regards to how particularly to strengthen the role of the health sector in achieving clean air in cities. Next slide. And I would like to start with very few key figures. The world is still falling short in achieving SDG 3 on health, SDG 7 on energy, and SDG 11 on cities. 7 million deaths annually occur due to the exposure to ambient and household air pollution, and 600,000 of these are children under the age of 5. And this is actually due to 91% of the world's population exposed to unhealthy air. We have heard this figure before, but also 3 billion people who are still lacking access to clean cooking. Next slide. But despite these developments and challenges, certainly there's a clear recognition that there are key opportunities for action at the very different levels of the government, the national, the regional, the global, but also importantly, the local. And indeed, cities do play a key role, and there are key opportunities. And which one are they? Next one. The positive news, and Helena, you just used a similar slide, is that we actually know which solution need to be put in place to deliver healthy urban environments. And we know, for instance, which sectoral policies have the potential to really protect and promote health. So this is clearly a key opportunity for promoting and protecting health and well-being of urban population, as many of these sectoral policies are actually implemented at the very local level. Next slide. But the second opportunity I would like to highlight here is the role of the health sector. So while the responsibility for policies impacting but also protecting health actually lies in the beforehand mentioned specific sectors, the health sector has a key role to play in providing the health evidence, both as regards to the health risks, but also as regards to the health impacts of policy changes. And the health sector is fundamental for building the health competencies of all those involved in the policy-making process at the very local level itself, including the health sector, and I will come back to this a little bit later. And so the health sector has actually a key responsibility in increasing health communication, but also in identifying, for example, at the local level, of who are the most vulnerable populations, how to reduce inequities through public policies, but also to ensure the best uses of resources at the level of the local level. Next slide. So building off what was just mentioned, I would like to provide some very few concrete examples of where the health sector can support the policy-making process at the local level. And I would like to document this with some examples of WHO's work. And one of the key roles of the health sectors is indeed in providing evidence on the determinants of health and inequity, and also on the effective responses. So on this slide, you can see some example of the existing guidance work related to air quality and health. But certainly this evidence building needs to be done in drawing on the local data and the local expertise. So the health sector needs to be playing a very, very prominent role in providing that evidence also at the local level. Next slide. The second key opportunity is the use of non-health data, such as data on the exposure of air pollution or the percentage of population with primary resilience on clean fuels, is actually a key indicator for health. So as you know, WHO is the custodian agency for the air pollution related indicators. And I would say that this is a key shift on how health data are collected and perceived and also used. So actually local governments have a key opportunity to address health by collecting key exposure data on risk factors that then in turn can be used as an indicator for actually the health status, and then can be used for driving policy choices at the local level. Next one. The third opportunity is to develop and use tools and knowledge and guidance that does support and push for urban sectoral policies and interventions to tackle air pollution, while harvesting multiple health, environmental, and climate benefits. And Helena was really highlighting the strong linkages. And for instance, there is a series of knowledge products on specific sectors, such as transport, housing, energy, and others, as well as on approaches and methodologies that address health at the local urban context. So these tools are actually an essential mechanism for bringing the different sectors together through targeted trainings, but also to get them speak in some kind of way the same language. Next. So that includes also the development and the adaptation of analytical tools at the local level to facilitate the assessment of the health and economic impacts. And so again, these tools, they not only facilitate the type of assessment, but they also help to open a dialogue across sectors. And certainly they need to rely on the contribution and the evidence provided by the health sector itself. And the next, and we should not forget the health sector itself that needs to be trained on air pollution. There is clear evidence that the health sector needs to be better knowledgeable on the health effects of air pollution. So capacity building needs to be done in order to have the health workforce itself being able to inform patients, treat them, but also then influence decision makers in other sectors. So the health workforce itself is a key player there at the local level. And the last entry point, so the next slide, for health is certainly through an increased communication and partnership. And we all have already heard about the important role of BreatheLife as a network to foster exchange and experience, but also mutual learning between cities and communities. But one important thing about communication is also that we need to provide key information and communicate key scientific knowledge in an understandable way, although keeping it scientific. So you can see here these tiles, these mosaic tiles. It's a project that WHO has been launching recently, and it captures a series of videos that has been done with a large number of key experts who are explaining key scientific information on air pollution and health in a very straightforward and also very simple way. Next slide. And so in conclusion, I would say that all these tools, all these opportunities are actually necessary for the very different policy-making steps at the urban level. And so they are part of a pilot project and a model process that WHO has been developing. It was partners, it was a CCAC and others, which is called the Urban Health Initiative process. And we will, I'm sure, hear about that later. And this integrated approach really helps, to address air pollution and climate change mitigation. And it has been, showing a lot of success stories. So to conclude, I would just like to highlight some of the key accomplishments, by, having the health sector playing also a leading role in engaging with the other sectors. And I think the very first accomplishment is there's an increased political commitment across the globe to meet air quality guidelines set by WHO. And you see it by the members of BreatheLife, by the countries who have, committed to action at the climate summit, but also at the air pollution conference. So indeed, there is really a clear increase of commitments at the very, very local level. The second, next slide, key accomplishment is what I was mentioning before, that there is a recognition that air pollution is an indicator for health. So I don't want to go into more detail, but the fact that more and more cities and towns are actually reporting on their air pollution quality and are part of the WHO air quality database is also a sign that there has been an increased commitment. The third leadership accomplishment is that certainly air pollution has been recognized as a risk factor for NCDs. And this translates in, increased local NCD plans with air pollution being included. with related city indicators and with health supportive policy. And I think that this really is a key achievement. And my final slide is that the country accomplishments, and we will hear more from our colleagues from Ghana, is that the Urban Health Initiative has really been highlighting the substantial health and economic impact, that can be achieved if a city and a country fully implements, policies that are sectoral policies in a way that they are benefiting health. So I think this indeed is a key, a success. And with this, I would like to end, and thanks to all of you.
Thank you very much, Natalie, for that very inspiring presentation from the World Health Organization. Now, to hear on Oliver Lord, the policy and campaign of the Global Air for Europe, to please relay to us the story of London.
Hi everyone, it's a pleasure to be here today and to be celebrating World Cities Day. I'm joining you from London. My name's Ollie Lord. I work for Environmental Defence Fund Europe, and it's our new faction of Environmental Defence Funds who have been running for decades in America, fighting the good fight on all environmental concerns. I'd also like to say I'm very grateful that today's event is taking place in English language, as I only speak one language, sadly, but I'm very grateful to everyone participating. So we have been working around the globe as part of a global clean air initiative in London, Oakland and Houston, and we aim now to be working elsewhere, such as in countries like India, to map and measure air pollution. And we had a signature project in London called Breathe London, which you can see on your screens right now, which was our air quality flagship project, monitoring project with the City of London, where I actually used to work, and I had the privilege of working with the Mayor of London when he signed up to the BreatheLife campaign on air quality policy. And we found, great insights that levels of air pollution vary much more widely than previously known, and it can vary up to 8 times just within one city street. And this is really important for the action that's being taken in the city. And air quality is so important that it was recently referenced in the European Public Health Alliance report that talked of the social cost of air pollution being £10 billion a year in London alone. And it explained that monitoring is so necessary so that we get an accurate relationship between human health and air pollution, and it can be assessed. So we need a systematic and uniform way to measure air pollution, so we don't actually underestimate the impact of air pollution, or indeed, I'd add to that, that we don't glance over inequity that's also happening as a result of the health impacts of air pollution. And it's monitoring is about bringing data to life, really, and identifying things that the modelling doesn't quite see. And we kind of see there being 3 goals being served by monitoring. It's about identifying pollution hotspots at a local level. It's about raising public awareness, which I think is really important as a driver for action as well. And the UN Secretary General statement talking about when urban communities are in policy and decision making and empowered with financial resources, the results are more inclusive and durable. It's about engaging with communities, and that's where monitoring can really help. At the moment, 9 out of 10 Londoners see air pollution as an issue, and nearly half are saying it affects decisions in their day-to-day lives, especially those that are impacted the most, such as parents. And we use monitoring also to measure how well an intervention is working, of course. It's really important that policy and clean air policy is grounded in data so that we get things right, because we just heard recently about needing to combine the action, for example, on climate and with air quality, so we don't actually repeat mistakes of the past, such as the issue we face in Europe with diesel emissions or combined heat and power plants in buildings. But there needs to be a balance between modelling and monitoring, the type of pollutant that's being measured. So we don't need monitoring everywhere. But even with the big network in London, we couldn't cover everywhere where people live. So we need to make sure that monitoring is also in areas that are representative of where people are most exposed, talking to what Natalie was talking to earlier. And the biggest benefit is using monitoring to validate modeling. So And it's not a short-term endeavor, but it needs to be done in the much more long term. So why London? Well, big history in London with air pollution, as you probably know about the Great Smog, the Clean Air Act legislation that came in. We've been breaching legal limits for nitrogen dioxide for the past 10 years, and nearly all of every Londoner is exposed to PM 2.5, which is above WHO guidelines. And we had an established network of monitors. So on the map, you can see in front of you, the diamond shapes are actually the regulatory network, and the circles are the Breathe London sensors that we put in so that we could complement each other. And importantly, there's also political ambition. And I will say this, having recently worked at City Hall, that the mayor really wants to improve air quality. And those new policies he's introducing gave us a really good opportunity to use monitoring to assess their impact. So we created Breathe London with lots of scientific partners and alongside the Mayor of London. And we created this interactive online map, which you can see, which show current average air quality levels and also the sources. And it's a diurnal plot that helps to bring it to people's lives. So, an example being, now we can kind of monitor air quality every 15 minutes, every hour, sorry. We visited a primary school where kids would run around in the playground during the day, but the teachers would start to use the data to understand the better time for the children to be in the playgrounds. And the Breathe London project was built on 3 different work streams. One about putting 100 sensors out there to advance science, test new equipment, and try out analytical methods. We did lots of assessing, and it was good to see the difference between how PM levels change, NO2 levels change with the rise and fall of traffic. And that's allowed us to identify hotspots like a bus garage where buses were moving in and out of the bus garage and affecting the air pollution right outside people's houses, or longer term actions such as the introduction of the ultra low emission zone, which has reduced nitrogen dioxide by 25%, or indeed the impact that COVID has had recently with the restrictions in the city, that has actually seen a similar reduction in nitrogen dioxide recently. And we've used the data also to start to understand the different sources of what's causing that air pollution, because it's one thing to monitor air quality, but if you don't actually know what's causing it, then how do you start to overcome that challenge? To complement those sensors, we also worked with Google, where we had 2 of their Street View cars running about 25,000 miles in the city monitoring air quality. And they found that air quality was worse, about 50% worse on the main roads than on the roads. And we turned that also into a Google Earth visualization tool. Go back to that point that a lot of monitoring can really help to raise public awareness. The other element was around using school children as well with backpacks that measured air quality with university partners. And that really also helped to understand where school children are most exposed. And it was actually when they're traveling to and from school in the morning. So just to close, really, I hope you found that interesting. You can visit breathelondon.org to read about the project, but we will be releasing a blueprint and a technical report for all you geeks out there early in the new year, so you can learn much more about the project and how you can introduce similar initiatives. And right now, we are busy turning this data into action, supporting campaign groups on the ground, and pushing for ambitious policies ahead of the London mayoral election next May. Thanks very much.
Thank you very much, Oliver, for that very interesting example. And moving from London, we now go to in is for of the transition to electric air coordinator, Environmental Secretariat, Maria Valeria Suarez, to share with us the story of Quito.
We can't hear you.
Valeria, we cannot hear you.
Nope, not yet.
Now? Okay.
Oh, perfect.
Yes, perfect.
Okay. Oh my God. Okay. Sorry.
Sorry. So stressful.
Okay. Okay. Again. Good
Perfect.
morning, everyone. Good morning. Good evening. Thank you very much to invite me to talk about our work to make in Quito, about our comings and goings about sustainable mobility, especially the electric one. And then also, I'm so happy to start to be part of this marvelous group of BreatheLife family. We think that is an incredible opportunity to share experience, to help each other, and also, of course, ask for help. Help each other to propose innovative and ambitious initiatives that can be achieved as a group. Thank you very much for the opportunity to be part and to start to work together. As I mentioned, I'm coming from Quito, the capital of Ecuador, that are located in the slopes of Pichincha volcano at 2,800 meters over sea level and in the middle of the world. That particular force said to the city grow very long with a complicated topography and with a lot of solar radiation hours. Quito already has almost 3 million of inhabitants, 600,000 vehicles that use a bad fuel with huge amount of sulfur. And the most of the travel cross the central part of the city. This is a heritage because of the narrow space to develop, causing a traffic. The air quality data collected during the last 10 years show a problem with PM 2.5, causing for the bad combustion because of the altitude, obsolete car technology, and others, with peak of pollutants between 6 and 9 in the morning mainly, producing excess of our standard and, of course, of the WHO guidelines. Quito has I present in this slide our principal emissions, supported also for the emission inventory that we make, and also for a P5 source approach that we already make. That correlate with the results and show that the principal source of that mobile source contribute with more than 70% of the emissions in the air of Quito. Quito has an ancient relationship with the sustainable transportation, specifically electric. First trolley car started to work in 1914 until 1940, when the government decided to give way to fossil fuel vehicles as a new fad. Extend use of bicycle for short trips. Then in 1995, we returned to the trolley bus, and this was the first Central and South American region to be installed. This trolley still works until now and makes 240,000 travels per day. That is approximately 8% of the total travels in public transportation in Quito. And it's important for us that this technology don't use batteries. That is important for our city because we still do not have facilities to treatment batteries to put in some place to recycle. And also we don't have yet electric stations. Norwise, we are a commitment to reach the establish of the standard of air quality of WHO. So since 2015, in the Metropolitan Land Use Plan, the promotion of clean technologies in public transportation, giving way to the develop a plan of electric mobility and the replace of existing public transport units by electric ones. Where the main one is the Metro of Quito that we to work in 2021, and it has been planned to make 4,000 trips per day. The following are change of 81 new electric buses to enhance the ordinance promotes electromobility, giving incentives to use this kind of mobility. And of course, other actions in order to have a sustainable mobility, improving cycle lanes and pedestrian-only streets. As an additional note, but one that encouraged us to the policy could generate positive effects, was the decrease of more than 50% of PM 2.5 during the lockdown months, where the mobility was reduced by 70% in the month. So this shows us that our policies and our decisions to change the kind of mobility, to change the fuels, to migrate to a clean energy, it will be really positive for our city, and I will point that is try to reduce the PM 2.5. Much for your attention, and it's a picture of the principal squares of Quito, and you're welcome to visit us. Thank you very much.
Thank you very much, Valeria. And I'd like now to call on our final speaker to share with us the experience of Accra in Ghana on achieving multi-benefit with welcome sustainability and resilience advisor to the mayor.
Thank you very much, Glenda, and it's a privilege to be part of this discussion today, and happy World Cities Day to everyone. I hope that you can all hear me clearly, and it's a bright and sunny afternoon here in Accra, so we are very excited. In 2018, the mayor of Accra launched the BreatheLife, Accra joining the BreatheLife pilot project, and since then, we were very happy about it because we've been working on the resilience strategy and also working on the climate action plan. And it was clear that air pollution is one of the areas we need to pay attention to. Again, of the sources of pollution in terms of climate change that we're focusing on was from the waste sector. And so bringing the equation of air quality issues, we thought was a great addition, and also was a point of focus for us because we were not paying that much attention to air pollution at the time. But one of the key things that the BreatheLife project also helped us do is to appreciate the statistics and the impact of air pollution and air quality on our lives. And so for us, we thought highlighting the WHO, working with support from CCAC and ICLE and the others, highlighting the number of deaths that were experienced in Ghana, ensuring that we were able to show the NCD related deaths, and also, even if not deaths, but even the reporting of diseases which we're not particularly paying attention to initially was quite interesting. We realized that for us, our climate action plan and the other actions we're developing would not be meaningful unless we're able to link it properly to issues of air pollution and air quality. And so we established we needed to focus on waste, because in Accra, most of our pollution, not just related to climate, was 46 illegal waste dump sites in Accra, and we mapped it out. We were able to, through the leadership of the mayor, to close about 37 of these illegal dump sites. Some of these areas were created because of poor waste management in some communities. And so the BreatheLife, we picked 2 communities that we believed had very high incidence of burning of waste as a means of disposing of the waste. And we focused in those communities. And some of the actions we undertook was a lot of emphasis on community engagement. And we were very excited that the traditional leaders also got on board. The assembly members, and we will see assembly members here, the lowest level of governance is the assembly members. They are the first of engagement with the community. They were also very involved. We also involved as part of this project of the churches to engage with the statistics that was now available to us and the tools which are available to indicate the clear linkages between the quality of air and health. We're able to engage these churches, engage the communities to make them understand what it meant if they kept on burning the waste. The structure of waste management in Accra is that we have private companies that collect the waste from the households, but the households have to pay for these services. So in a number of communities, people after a period do not want to pay, and also the waste collectors also refuse to be going into those communities. And so we identify that if we are able to show the linkage to these communities, it may help them to appreciate why they have to be paying for the service and not to be dumping, because there's some extra cost which they were not seeing immediately. And that community engagement helped us to be able to bring these things out a lot more. And part of this project, one of the things we're very excited about was the emphasis on partnerships. So we had to partner with the Environmental Protection Agency, the Ghana Health Service, the Ghana Education Service, to ensure that we do the community entry on also school-going age children as one of the tools which can help to ensure their parents or in the household, they can promote some segregation of waste and not to burn as a means of getting rid of the waste. As a project also, we were able to distribute some bins of the waste. Was also a condition we identified, that the way people store the waste impacts whether they will segregate them or how they will get rid of it. So we distributed, the households we're targeting was 200 households in those communities. We distributed 2 bins and the recyclables, have another for the other waste. At the time, we had not undertaken a waste characterization exercise to be able to show the composition of the waste, but now we have been able to do that with support from C40 because of the climate action plan that we're developing. And so we've seen that the engagement of these other governmental agencies, Health Service, EPA, Ghana Education Service, has helped us and ensured that the community leaders as part of the project are the ones who are enforcing in their communities to be sure that people do not dump the waste anyhow. Another thing we saw was that the waste companies or service providers who at a point were not coming back into the community to collect, now saw that people understood why they had to be paying for the waste. So generally, I think the key accomplishments has been everybody appreciating that air pollution is a key contributor to climate change. Close collaboration with the EPA, especially on communication. We now have an air quality management plan for the city of Accra, which has been developed by the EPA. And also we liaise with the investors. We've now even mounted an air quality monitor on top of City Hall that we can go online and see the state of the air at any time. So we've been very glad about this process. And fortunately, there's a phase 2 that we've selected other communities to be part of. So we thank you all, and we hope that we have a good program. Thank you.
Thank you very much, Desmond, for that inspiring story of solving open burning of waste by better waste segregation through partnerships, communication, and political will in Accra. And just recalling all of the very inspiring experiences from the other cities. If you recall, London was able to use data, air quality monitoring data, to better inform the public and the decision makers on air pollution levels to guide action. Action not just at the city level, but also even at administrators were now looking at air pollution data to ensure that children, when they play, are protected from air pollution. And from the story of, from the case experience in Quito, how moving away from fossil fuel run public transport and shifting to electric vehicles was able to contribute to cleaning the air. Now we have the opportunity to discuss a little bit more in the Q&A, and we have a few questions which I would request our panelists, our speakers, to share more of their thoughts and ideas. And may I request at least our speakers to put on their video as we move on to the next part of the agenda, which is the open forum or the question and answer. Thank you. So we have heard a lot of very inspiring stories, and the theme of this World Cities Day is valuing our communities and cities. May I ask our speakers from the cities and the international organizations like CCAC and the World Health Organization to share with us your thoughts on how we can better integrate air quality with other concerns of local citizens?
Linda, happy to start.
Go ahead, please.
Sorry, Helena. This is Natalie. I just start very quickly, and then I'm sure we will be aligned. So, just coming from a health perspective, I mean, certainly it's important to note that if we speak about the benefits of addressing air pollution, not only we have heard, and Helena certainly will build on that, about building also on the benefits of climate change mitigation and related, health impacts, but there are a lot of, co-benefits that actually result if we do appropriate measures to decrease air pollution in cities. And just to name a very few and just to give a couple of examples, if, for example, we change the ways our cities, are structured, the planning of the cities, which will maybe increase the opportunity for people to use bicycles or walking, certainly this will have not only an impact on reduced car use and therefore reduced air pollution, but also will have benefits in better physical activity and reduction of obesity. This is just to mention a couple of them, also decreased injuries due to road traffic, and not to mention also the co-benefits as regards to mental health and well-being. So this is just a couple to mention from my end, from a health perspective. And I was speaking about the NCD agenda before. And not only it's important to recognize that air pollution is a risk factor for NCDs, but that addressing air pollution will have a benefit, on the multiple levels of risk factors and health outcomes. Over.
Thank you, Natalie. Helena, you wanted to respond.
Yeah, no, very quickly. I wanted to just add my own thoughts. So we have the youth movement now a lot engaged on climate action on the streets, the Fridays for Future, or is it Friday for Future and other movements? And you can see around in cities and in schools around the globe. So I think this is something to build on, and they are not necessarily so much informed about the air quality and health impact of measures. They're more concerned with the problems created by climate change. I think it's a good way for us to be able to convey to them these kind of messages and build on at least the concern. And on the other flip side, there's also other movements around the world where there is difficulty in introducing cleaner fuels and sometimes carbon taxes and other things that has been proposed to reduce emissions and pollution. And so it's also, and so often it's because there is also not enough information or understanding by the population or involvement by the population in why certain things needs to actually sometimes cost, but that they will also benefit people's lives in a very concrete way. And I think what Desmond was talking about on waste in Accra, and also what we heard from Quito about the mobility, electric mobility, and the lack of batteries, etc. But there are still solutions that can be made. I think it's about how can we help to make this case much more visible, and also to then engaging these community leaders or youth leaders or other movements going on, which do not necessarily connect all the dots. Back to you.
Thank you, Helena. Yes, Valeria.
Yeah, I would like to say that we are going through just the right time to create these synergies, because people have a very recent antecedent of clean air down. In addition, the virus put respiratory diseases in the table. For that, the lockdown has relieved the inequity with the cities, because it's not the same to be locked down in a well-served urban center than in a low-income extramural. Here was 2 channels to establish synergies between public health and urban planning with air quality. Thank you.
Thank you, Valeria. And Oliver has some thoughts. Please share these with us.
I'll just be very quick, but I think it's also worth talking about how air pollution can uncover inequity as well in our cities. And there's a lot of discussion around environmental justice and helping people to understand that the actions of certain communities can also really disproportionately affect actions to the health impacts on other communities. So I think that's really important as well.
Thank you. And I had a question here on Natalie. How do you think more engagement from the health sector could inspire more action on the ground? And others are free to respond as well.
So thanks a lot, and indeed this is the key issue, and I think it relates back a little bit to the presentation that I've made earlier on, where I was really strengthening the importance of the role of the health sector at the local level to be really highlighting and supporting with the evidence about the health impacts that sectoral policies have, and also not only the health impacts but the related costs. So a way really to leverage on that is really to have the health sector playing this stronger role in providing the evidence and also the related costs. And it's the understanding that indeed air pollution is not only a health issue or a health sector's issue, but that air pollution, if we want to tackle it comprehensively, and we want to tackle all the impact that it has on health, needs to go out and reach out to the other sectors. And the last point is really another point that I really feel it's important is the health workforce. I mentioned this in the presentation, the need for capacity building for the health workforce, because they are ultimately the first contact of people who are mostly affected by air pollution, the patients. And if there needs to be better knowledge, on how air pollution really harms our bodies and our system, and therefore health workforce needs to be, strengthened there.
Thank you very much, Natalie. And since we are very close to the end of the webinar, may I ask all of you to please inspire us and share with us what has inspired you most in your fight to improve air quality.
I think I would go first here. I think the biggest inspiration has been the ability or the opportunity to link the health impacts, and I think a few of the speakers have alluded to that, to the other developmental challenges that we have. So even though, for instance, in our case, our focus was on climate change. If you go talk to people about climate change, it doesn't make much of a meaning to them until you're able to show that there is some kind of linkage in terms of air quality to their personal situation, something that can affect people personally. And I'm glad Natalie also mentioned about the cost. I think there's a question in the Q&A, the cost implications and health implications. If you put that together, get the policy implemented, begin to. So that's an inspiration, I think. Yeah. Thank you.
Thank you, Desmond. And indeed, thank you for referring to a question in the chat box. So cities, however, struggle to implement some of the solutions that have been mentioned. Do you think this is a governance challenge and not as much a policy issue? So please feel free to speak of your inspiration and also possibly to give advice on whether this is a governance challenge rather than a policy issue.
I'll just chip in quickly. That's what Valeria wants to say something as well. I think from an inspiration perspective, amazing. It's very inspiring to see change on the ground. So we talk a lot about targets in the future, achieving World Health Organization guidelines by 2030. But in London, we've seen the London taxi drivers embrace electric vehicles. And, maybe several years ago, you would have thought they'd be the last to do that. But, they're great ambassadors for this change we're seeing now. And in response to the city's question, yes, to some extent, it really is a governance challenge. If you take London as an example, the Mayor of London controls 5% of the road network. 95% of the road network is controlled by 33 different authorities. So how you can implement a integrated transport strategy is actually quite challenging when you know that at the side of the road, up to 80% of the pollution actually comes from vehicles, but we're doing our best.
Thank you, Oliver and Valeria.
I want to say that as a resource that equalize people because it's essential for life and do not understand ethnic groups, social classes, gender, borders, also that level of exposure containers does depend on our social demographic position. Furthermore, in general, the individuals that cause the lower generation are the most affected by pollution. So the fight against air pollution is a fight that makes us equal, that commits us and should commit us all to make our cities more livable. That I want to say. Thank you.
Thank you.
So if I can just say one word before as well on this, what I feel very inspired about is that it's really the air, the atmosphere we breathe, everybody breathe, everybody, it's not only a few people, even though there is justice issues and there is exposure issues and there is difference depending on where we sit and what resources we have and which city we are in. But the fact that I think that's an inspiring fact that the air is something that we all, it's like water, we need to breathe, we need to have water to survive. And therefore, I think the benefits and the engagement of people that get that kind of understanding and can get engaged with very, very concrete solutions. Even though if you look at cities, many cities and the impact on air pollution in cities are outside the realm completely of the cities. So it's not that you control all the sources, but at least if the policy element, so it's about policy and governance as the question was here. So cities like Delhi, for example, I think more than 50%, 60% comes from agriculture and external sources to the city. So independently, they cannot use it on their own. And not only controlling, as you said in London, the road network, it's also like where actually the pollution is generated. So definitely a governance issue, but it starts somehow at home, and it starts with this broader understanding and the demand and also the acceptance of certain limitations I live in Paris, and the mayor here has been extremely outspoken, as you know, Anne Hidalgo, for air quality issues. And she almost lost the elections because of this, because many people were very upset because traffic was interrupted, or there were certain measures that we all promote as being very useful and progressive, but that people were not ready to take on board. So it's a question of also how courage, I think, leadership issues, it's governance, but it's also you need to take certain, stick your neck out and propose solutions that might not always be very popular. Therefore, you need this feet on the ground and people that supports these kind of issues as well. Inspirational, but also difficult.
Natalie?
Linda, maybe from my end, just to respond both to the inspiration, but also to the question that was raised, I would say when we look at policy and governance challenges, it's a bit of both. From my perspective, as also previous speaker have said, from a policy that indeed at the local level, you need to assess which policies are mostly relevant for the local, context. So you need to calculate. So the policy is an issue. You need to identify what needs to be changed. And the governance certainly, is a problem because you need to strengthen the collaboration between those different sectors involved. But this brings me actually to the inspiration. And I think what has inspired me over all these years working in environment and health, so not only air pollution, but air pollution specifically, is that success can only be achieved if there is a strong collaboration. I'm representing health here, from the health sector, but from all the sectors, but also all different stakeholders and all the different levels, of government. So it's a true collaboration if we want to achieve positive results. And this is an inspiration.
Thank you very much for all of your responses. And what we would like to hear more from you, as we have examples that you have shared, especially in the cities that we have here, speaking of all of the success that they have attained through collaboration with the different stakeholders and through the use of data and just aiming to provide clean. We do need to come to a close in this webinar. And so just taking from all the examples from the cities and also the situation where we are in now, as countries throughout the world really grapple with the escalating human and economic cost of the coronavirus, attention is also increasingly now being focused on longer-term recovery efforts and the real potential of reshaping our national and city economies and fiscal priorities in a post-COVID-19 era. And now thoughts are more and more turning to new visions for the future and the building of more equitable, robust, and sustainable city systems. And in many ways, the pandemic is really also demonstrating to some degree how cities and countries are able to act swiftly and in many, many parts of the world collaboratively to address a global public health crisis. And in the aftermath, we must focus on harnessing that same spirit and energy in continuing to fight the climate and air crisis as the next imminent existential threat. Climate change and air pollution are truly the next curves we need to flatten with the same urgency, the same channeling of resources and resolute, which we have seen by countries and cities across sectors. And let me end by quoting some very powerful sentences, message from the UN Secretary General for the World Cities Day about how cities and local communities really play an important role in this post-COVID recovery. And he said, as we rebuild from the pandemic and engage in the decade of action, sustainable development, we have an opportunity to reset how we live and interact. And local action is the key. When urban communities are engaged in policy and decision making and empowered with financial resources, the results are more inclusive and durable. Let's put our communities at the heart of the cities of the future. I couldn't have said it better than that. And let me thank all of you and all of our speakers, and especially our host, the Climate and Clean Air Coalition, for helping us celebrate World Cities Day in such a special manner. Thank you all.
Thank you.
Thank you.
And
Thank you very
happy
much.
World Cities Day.
Thank you, everyone.
Thank you.
Bye-bye.
Bye-bye.
Bye.